Welcome back to Health Daily. I'm your host, Dr. J. Today, we'll focus on the news today as this is Sunday, so you're on active recovery day today. But let's get to the topics today. And tomorrow, make sure you join me tomorrow because we'll talk about the protein sources that you're probably ignoring. Let's get to Google Trends today and talk about the first story here, which is going to be Michael Strahan still in the news. And if you've been following me, you know from yesterday and the day before, we talked about Michael Strahan's daughter, which is still in the news. You can see that it's still spiking here about the brain tumor diagnosis. So we won't cover this in full detail, but I'll drop the link below so you can take a look at the video from yesterday and discover all about the brain tumor and what is it, who does it affect. But let's go to the next topic here, Brittany Mahomes. I didn't really find too much on the Brittany Mahomes topics for health. I think it's because she's pregnant that she's in the news. This is more talking about her daughter. So we'll skip over this topic and go to Taylor Kitsch. Taylor Kitsch, and let's go to this article here. So this is in the news because Taylor Kitsch is opening a nature retreat on his 22-acre land in Montana to serve the sober community, kids, and veterans. So this retreat is, according to this article, is a tip that had to his sister Shelby, which beat opioid addiction. So Kitsch hopes to offer a chance for people to reconnect with nature and to slow down, inspired by his sister's journey. And I think that they also plan to work on a film or a TV show about his sister's journey and her journey to sobriety, which would be very interesting. Let's talk about the next topic here, which is Paxlovid. Paxlovid still trending in the news. And let's go to this article here that talks about Minnesota COVID cases. So this article is talking more about the fact that the access to Paxlovid is becoming harder. So patients are reporting difficulties accessing the anti-COVID drug Paxlovid. So as you can remember correctly from 2021, and that this medication became widely popular, giving out by urgent cares and doctors and facilities. And so COVID cases are on the rise in Minnesota, which we expect around this time of the year. So financial support options are changing. So full coverage of Paxlovid for people on Medicare has been extended through February, and private insurance individuals can apply for up to $1,500 in support or rebates, according to this article. And age and risk factors are disputed. Right now, CDC encourages treatment for anyone over 50. However, some practitioners, some doctors have different opinions on the age cutoff. And so talk to your healthcare professional if you're considering this or you're concerned about this. Make sure you like and subscribe to our video and to our channel. We're trying to grow this network. We're trying to get back to 5,000 subscribers. Make sure you share this with somebody that you know that you can use it. Prescribing Paxlovid is becoming more selective. Recent research has led some doctors to be more cautious in prescribing Paxlovid. And pharmacy and billing is still issues sometimes with this medication, but there could be financial support. So make sure that you're checking with your practitioner, your healthcare service to see if you do need this medication, that you're finding out how to get help with this medication. But back to the trending topics here. Clayton County, Georgia is in the news because of bird flu. So what is going on with Clayton County, Georgia? We'll share this article here. So Clayton County, Georgia, let me scroll down here. So a small backyard flock in Clayton County, Georgia, has been confirmed to have a highly pathogenic avian influenza. This is Georgia's fourth detection of this particular strain since the nationwide outbreak in 2022. Contaminant measures have been implemented, including depopulation. The owner of the small flock noticed the bird mortality rate went up. And so this is how this was found. And so now they're urging backyard flock owners to remain vigilant and report sudden increases in bird illnesses. So let's see what else is going on in the trending topics here. And so we'll go to flu symptoms of 2025. So this is talking more about COVID, even though flu symptoms are in this topic. But let's check this out here. Well, we'll skip over this one. We know COVID is surging, so we'll skip this one and go to the next one because this is kind of interesting. Brian Johnson, and if you're not familiar with Brian Johnson, it's been interesting watching Brian Johnson, but I will let's go to this really quick so you can see he has a documentary coming out, but just to give a long story short, Brian Johnson is an anti-aging activist or advocate who's been taking around, over 50 pills a day. He has been trying to discover the anti-aging routine. But let's play this. Let's play a little bit of this.
As a species, we accept our inevitable decay, decline, and death. I want to argue that the opposite should be true. My name is Brian Johnson. I've been spending millions of dollars creating an anti-aging protocol. I take 54 pills, red light therapy, plasma exchanges, and I'm going to be injected with my first gene therapy. Thanks, Doc. I'm trying to be on the outermost edge of possibility for the science.
We publish all of his biometric data online.
So tell me what you think. Comment below. Tell me what are your opinions on Brian Johnson's routine, what he thinks that he will be able to do with this. Tell me if you would do it. And I think this would be an interesting conversation going forward. So tell me how you feel about this story. Tell me how you feel about what he is trying to accomplish. And tell me if you think that he will accomplish this. Next in the trending topics is Olivia Munn. So Olivia Munn, we talked about this before in earlier episodes where we talked about her breast cancer diagnosis influencing another person to get the same risk factor stratification report or go to a doctor to see her risk for breast cancer. And so let's play a little bit of the video and see what this says here.
I feel good, and I just feel so grateful.
Inside Edition correspondent Allison Hall sharing her breast cancer story as she gets ready for a mastectomy at the age of 33.
I've never been told how young I am so frequently while I've been going through all of this.
It started with a story on actress Olivia Munn, who was diagnosed in her early 40s after taking a breast cancer risk assessment test.
I had never heard of the breast cancer risk assessment test, and I'm hearing from a lot of people that lots of people had never heard of it.
Dr. Marisa Weiss, the director of breast health at Mainline's Lankenau Hospital, says it's a series of questions.
They look at a list of risk factors that we know about. It's really important to figure out what your level of risk is.
Dr. Weiss says there can be an elevated risk even with a normal mammogram and negative genetic testing, which is why an MRI is usually necessary for someone who scores high on the assessment. For Hall, the MRI
So tell me what you think about this. Have you taken this breast cancer risk assessment? Do you think that it's necessary? Do you think that everyone should offer it? Is this something that you would be interested in? Comment below and tell me what you think. But again, what we said, subscribe to the channel. Make sure you share this video with someone that you think they can use it. As again, we will see you tomorrow. Health Daily today, every single day. I'm Dr. J. Thank you for joining me.